So what is frozen shoulder? Let's take a look. Frozen shoulder is also known as adhesive capsulitis, and there are two types. There is primary and secondary. Primary happens because there is something systemically that is off. Think thyroid, hormones, diabetes, something that is making you a little bit less optimal. Secondary means something else happened, like you tore your labrum, you tore your rotator cuff, you had a fall, and then maybe surgery, and your shoulder froze. So your shoulder joint is called your glenohumeral joint. And every joint that is a synovial joint, which means it has fluid on the inside, has a synovial capsule, a joint capsule. And I like to think of these capsules as like saran wrap around your joint. And if you know that ligaments are thickenings of this capsule, I think about that like saran wrap run around a couple more times at that joint. Adhesive capsulitis happens when there's an increased fibrosis or thickening of this particular capsule and the ligaments. Specifically, there is a coracohumeral ligament, and your long head of the bicep comes up and in there. So there is a fibrotic change. It literally tightens down. Now, fascia transmits pain to our brain faster than nerves. So this connective tissue, as it tightens down and becomes irritated and inflamed, is actually quite painful because fascia transmits pain to your brain faster than nerve. Here's a little snippet from a research article. Frozen shoulder occurs when the ligaments of the shoulder joint become swollen and stiff. So the entire capsule, but specifically a piece on the front called the coracohumeral ligament, and the long head of the bicep goes up through. Now, these fibrotic changes can happen in people that have diabetes. We know that in diabetes, there's a higher rate of inflammation. It's almost like because your pancreas isn't being helpful, it's all your body can do to deal with that glucose. And also there's impaired circulation. We also know that this happens when there is thyroid issues, insulin resistance, increased inflammation, and estrogen drops because estrogen helps keep things plump and flexible and decrease with inflammation. And so if you are a woman in perimenopause, menopause, as estrogen is going down, your ability to help your bone and connective tissue heal and grow and be normal is going bye-bye. You also will have increased inflammation because estrogen helps reduce inflammation. This is why frozen shoulder happens in women 45, 50, 55, 60. It's not exceptionally common after 60. Now, frozen shoulder can happen in men, but it happens in women more often than men. And the research is showing it is happening more and more in perimenopause and menopause women. And we're not sure why it's happening more now than ever before. Perhaps because 1 in 4 of us have a metabolic disease. And when you're systemically inflamed, your shoulder, for some odd reason, this specific kind of area takes a hit. The fascia gets angry. It's like an angry elf. So this is why if you have frozen shoulder, I talk about going to your primary care doc, getting your blood work checked, checking your hormones, checking your thyroid, checking your vitamin D, what's going on with your inflammation. And then we have to start a mobility routine to get you to move and lubricate that shoulder because movement is medicine. It's a multifactorial thing that has an eclectic treatment approach. You can check out my TikTok series if you want to learn more.